Okay, so here we go. That'll get edited out as I back it up. It zoomed in all of a sudden. Okay, so why don't you just tell me Bailey's story? How did you hear about vision therapy? Yeah, just tell me the story.
Okay. I mean, so do you want how we got into it, or what you want his kind of a little bit what we noticed?
Okay. How did you first hear about vision therapy?
When he didn't track. So the first time we heard about anything to do with vision therapy was when Bailey went for his 9-year-old regular eye vision summer checkup. And for the first time, it was noticed that his eyeballs did not only track, but really didn't move left or right like they were supposed to. And so it was suggested that we maybe do a further consultation. And so he went to the University of Incarnate Word Eye Institute and had a further evaluation done. And it was recommended to us after that session that he actually entered eye therapy. So that was the first time that we really understood that he was going to need to go through intensive eye therapy.
Okay. And I know it was a little bit of time before you started the therapy. What would you say to parents who don't have any idea how they're going to work this into their busy schedules? It's obviously quite a commitment. It's also a commitment financially in a lot of cases. What would you, and thinking back on it, how did you talk through it? How did you decide that you needed to give this a real chance to see if it would work?
Well, and that's how because we were waiting for the list at the university,
the waiting list, yes,
at the eye school,
yes.
And understanding and seeing, just the implications of the fact that my child's eyes weren't moving, and understand that he's getting older in school and needs to be able to move his eyes and not just his head. Then I started seeing out the other options. And I actually called the school and said, are there other options, private or whatever? Because apparently, I guess the pay structure or something is different at the high school. I'm not quite sure. Yeah. So apparently, I'm not sure. So apparently they have a very long list. So after being on the list for 4 months, then I sought out other things. And then was when we found Dr. Bloom's office, which then, of course, he went through the entire evaluation again with Dr. Bloom, got the same results. And then immediately, I guess probably within the month of the evaluation and all of the tests that were needed to happen, then he was entered into working with Lisa. And it was one of those things where just understanding that it was a necessity. So just as much the physical exercise of swimming and the necessity of going for regular checkups for his eyes and for his shots and all that, there wasn't a matter of fitting it in. It was, how is life going to fit around it?
So it was clearly evident in the way his eyes moved that it was a necessity. So it really.
So once you saw that pointed out to you, could you reflect back on some of the other struggles? What grade was he in, by the way?
He was between 3rd and 4th grade that summer.
Between 3rd and 4th. Okay. So how were you able to perhaps tie it back into just the way he approached things, whether it be school or at home?
So when he was an infant, a lot of times in pictures, his eyes would not be in line in the photographs. So early on, because of my eyesight, I had taken it to his pediatrician, and they were like, no, it's fine. They did the tests, whatever, and he was fine. So we didn't worry about it. And then because of his hearing and the number of sets of tubes he had as a toddler, he loved books, and he was always into books. So he would read all the time, so we never questioned his reading. It was a good time for us to talk about vocabulary and bring in the speech, because then as a result of his hearing, he was delayed in speech until he was 3.5. So we just kind of took the reading aspect for granted because he was so into it. Once it was pointed out that, he had distractibility issues in school, and they started coming up at about the end of 2nd grade. And the teachers would say he was off task whenever he was on the large carpet sitting with them, kind of in his own world is what they would say. It wasn't that he was up running around or fidgeting on the carpet and bothering other people. He just seemed to be kind of looking out the window, daydreaming, not paying attention. But then as long as he would read to learn at that point, the teachers really didn't mind. So it seemed like, okay, he was a quiet kid, wallflower. They just kind of let him be. By the time he got into his state testing at the end of 3rd grade, we noticed anytime he had to read a fiction passage where he needed to read top to bottom the entire story, he would fail it. And so we thought it was behavioral, that everything he'd read up to that point was about dinosaurs and trains and sharks, and he just liked nonfiction. And so we thought it was behavioral. Buddy, you have to read the whole passage.
Right.
You know, we don't care that it's about a fairy. You have to read it.
Right.
And so then that's where we went into the summer of him having the diagnosis to learn that the reason he liked nonfiction was because he could pick and choose where he read on the page, and he didn't have to read top to bottom.
Mm-hmm.
So what we thought was a non-issue because he was such a good reader really was a huge issue.
Right. Okay. And what about just coordination issues or outdoor activities or anything worth mentioning there?
So as the second child, compared to the first child, he was our clumsy one. He didn't like to ride the bikes. He didn't want to be outside. He would prefer to be sitting inside. He was our quiet reader on the floor. If he had trains or if he had dinosaurs or if he had cars, he was entertained. And he just always was in his little world. He preferred inside quiet to outside rambunctious. And
Okay.
so it
Even
was.
in the few instances when he would have the enthusiasm to go outside and play, he didn't have the coordination to do it. He couldn't catch a ball. He couldn't chase the kids. He would always say, "Wait for me, wait for me." So,
Okay. And so why don't we get to the end? So roughly 6 months of therapy?
He started in December and he graduated in July, so just over.
Yep, 7 months. And so as the process went along, what do you remember observing and realizing that, hey, this might be working?
well, first there was the frustration because I would come home and do the therapy with him at night, and you would see how hard it would be for him to follow the pencil or follow the Marsden ball.
Yeah.
And to keep doing it even though he was frustrated and I was frustrated and success was not quite there. That was difficult. But as we progressed and things got easier, he could do exercises that I couldn't do, and so that was nice to see. His work here at the office, as well as the work home, was paying off. And it's hard because you do have to just push through it, and you have to do it.
Right. Because if it was easy, then you wouldn't have to do it in the first
Yeah.
place, right?
It's the repetition that makes everything work.
Okay.
And I was gonna have to say, if this was my dad, he might. Hang on, I gotta call my dad back.
Okay.
He's got the other little one.
Cut.
Sorry.